There are many healthcare professionals who are experts in the diagnosis and treatment of head and neck cancer, who will be involved in providing care to you during your cancer journey. This group of people are called a multidisciplinary team, or MDT for short. The purpose of the multidisciplinary team is to ensure that you are offered the most appropriate treatment for your cancer. The team meet on a weekly basis and discuss all the investigations for each patient with a new diagnosis of head and neck cancer. This will include biopsy results, x-rays, scans, and other relevant information about your general health. This helps the team to design a treatment plan that is specific to your needs. You will always be involved in decision making regarding your treatment, and your wishes will be respected. If you've had surgery to remove the cancer, the MDT will also discuss the results of this surgery and decide whether additional treatment in the form of radiotherapy or chemotherapy is indicated. You will now learn more about the different roles of some of the healthcare professionals involved in your care and how they can support you.
I am one of the surgeons in the head and neck cancer team. You will meet myself or one of my colleagues when you come to the outpatient department. It is our job to explain why you've been referred to our team, provide you information about your diagnosis, and explain your treatment options, including the side effects. As head and neck cancer surgeons, we are specialised in performing operations to remove cancers from the head and neck area. Depending on the size, position, or spread of the cancer, we sometimes need to repair or reconstruct the mouth and the throat area with a piece of skin, muscle, or bone from another part of the body, such as the forearm or the leg. It is important that the head and neck team fully discuss your operation with you, so you know the extent of the surgery, the possible complications, and how the treatment will affect you, both in the short and long term.
I'm one of the 5 anesthetists who work closely with the other members of the head and neck team. We will be involved in your care before, during, and after any surgery which has been offered to you as a part of your head and neck cancer treatment. Our aim is to make this surgical treatment as safe, comfortable, and successful as possible. Before your surgery, we will meet you at this pre-op assessment clinic, where we will assess you if you are fit for surgery and suggest ways to improve your fitness levels. We will also talk you through your anesthetic and all that it entails. During the surgery, we'll make sure that you are asleep, you are safe and comfortable, and look after your heart and breathing. After the surgery, we'll also assess your progress on the ward in an attempt to minimize complications and maximize your recovery. Sometimes a breathing tube is placed at the front of your throat during surgery, and this is called as a tracheostomy. We will help look after this and remove it as soon as it is safe to do so. This usually happens between day 5 and day 7 after surgery.
Within our head and neck cancer team, we have a number of clinical nurse specialists who are available to discuss your diagnosis and treatment options and potential side effects. We also provide you and your close family members with support throughout your treatment and coordinate your care with other members of the multidisciplinary team. Often your clinical nurse specialist will be known as your key worker. When you first meet one of the clinical nurse specialists, we will provide you with our contact details so you're able to contact the team if you have any concerns or worries about your treatment or care.
The physiotherapist's main role is helping you reduce and manage the short-term and longer-term effects from treatment, but can also offer help with getting you as fit as possible for surgery. Directly after an operation, the physiotherapy team can help you with breathing and chest exercises and help with mobilising if needed. if you have had surgery to your neck, you will also be provided with important neck and shoulder exercises. After treatment, some patients develop lymphedema, which is a build-up of fluid and can be on the inside or outside of your face and neck. This appears as a soft, painless swelling and can cause a feeling of tightness around the neck. A specialist physiotherapist can help assess, manage, and give you advice on how to reduce these side effects from treatment, which include exercises and massage.
I am one of the speech and language therapists working with the head and neck cancer team. Patients having treatment for head and neck cancer may experience some difficulties with their swallowing and communication after surgery or other cancer treatments. This might include changes to how you speak, difficulties when eating or drinking, a hoarse voice, or restricted mouth opening. Some of these changes are temporary and caused by swelling to the mouth or throat immediately after treatment. For other people, they may be more long-lasting. The speech and language therapy team can assess these difficulties, provide advice, exercises, and techniques to improve your speech, swallow, and mouth opening, and help reduce the severity of treatment side effects.
Cancer and cancer treatment can affect your appetite and the way you eat and drink. Staying well nourished can help you cope with treatment, reduce the risk of infection, and help your healing after surgery. Dietitians can support you with issues around eating and drinking after surgery. This is because your chewing and swallowing is often not the same as it was before treatment. In some cases, you may require alternative feeding on a short or long-term basis after your surgery. This involves the placement of a tube to provide nutrition instead of relying solely on oral intake. This is something that can be discussed further with the dietitian if needed. Ongoing advice and support can also be arranged once you go home. You can also find further information throughout this online resource.
A clinical oncologist is a doctor who specialises in the use of radiotherapy, chemotherapy, and a range of other treatments. We are based in cancer centres in Belfast and Derry. Patients often receive their treatment and care in the outpatient setting. The treatment plan we prescribe is extremely varied and can be complex depending on the type and location of cancer, as well as how fit you are.